afternoon. I'm Carolyn Rice, School Board Chair. This workshop of the School Board of the City of Virginia Beach is convened at 4:03 p.m. on this 26th day of January 2021. Pursuant to the state of emergency related to the COVID-19 pandemic, the Governor's executive orders, the Virginia Freedom of Information Act as amended by the Virginia General Assembly, and the School Board's April 7, 2020 emergency resolution, the school board and selected staff members will meet in person in the school administration building. However, at this time, it's impractical and unsafe to allow other persons to attend the school board meeting due to physical distancing and safety precautions related to the pandemic. Members of the public will be able to observe the school board meeting through live streaming on vbschools.com, broadcast on VBTV Channel 47, and on Zoom. It's the school board's protocol to break at 4:30 to prepare for the regular meeting to follow at 6 o'clock. At 5:30, the board will conclude its formal meeting unless the school board votes to continue until 5:45. It will conclude no later than that point to allow the board and administration to prepare for the formal meeting at 6 o'clock. So with that, we begin with school board administrative matters and reports. We did have, I will report our mini retreat earlier today from 11:30 until 3:30 or so. So a lot of what might have come up at this point was touched on then, but I still want to allow any member who has any information to share with us before we get to the focus of today's workshop. Is there any member who has anything to report?
Other than will you please tell our remote participants that I'll be monitoring this?
Mrs. Melnick, would you go ahead, please? And she has a quick comment to our Zoom participants.
My colleagues, I have my computer. I am hooked into Zoom. And if you need to speak, if you use the raise hand feature, I will place your name in the queue and we'll keep it moving.
And Madam Clerk, would you do a quick roll call for us, attendance? Thank you.
Yes, Madam Chair. In chambers is Ms. Rye, Ms. Melnick, Ms. Felton, Ms. Riggs, Ms. Franklin, and Ms. Hughes. Attending via Zoom is Ms. Anderson, Ms. Weems, Ms. Holtz, Ms. Owens, and Ms. Manning.
Thank you. And members have asked me to add Mrs. Anderson is presently out of town on a family matter. Mrs. Weems is quarantining due to the, I was going to say the imminent birth, but the birth of of a new grandchild this afternoon. Mrs. Holtz and Ms. Owens are remote with us today due to health reasons, and Mrs. Manning due to a personal conflict. Okay, so with that,
This must be for, you said, any matters from the, she has her hand raised.
Mrs. Manning, did you have an admin matter to speak to?
No, I was just raising my hand to say that I was present. I'm sorry.
Okay, wonderful. Okay, glad we got that cleared up. All right, so with that further clarification, we will now proceed to our single topic for this workshop, 2021 pandemic plan updates. And we are beginning with Dr. Bergen, our Chief of Staff. Good afternoon.
Good afternoon, Mrs. Rye, Mrs. Melnick, school board members, Dr. Spence. For our viewing public, my name is Mark Bergen. I'm the Chief of Staff, and I'll be joined by other members of our senior staff to provide a number of updates for the board and the community regarding our 2021 school plan. I'm going to begin this workshop with a review of the percent positivity for the Eastern region since the start of this month. And then I'm going to be sharing some updated guidance with you that was just published last week by the Virginia Department of Education and the Virginia Department of Health, as well as information just shared last week from newly elected President Biden. We believe that this new information from both the state and federal government levels fully supports our recommendation and the board's action to move forward with the safe reopening of schools for in-person instruction. After I make those remarks, I'm going to ask Dr. Lindsay to join us via Zoom. Dr. Lindsay, the medical director for the Virginia Beach Department of Public Health. She's going to be sharing with the board and the community an update on our efforts to increase our contact tracing capabilities. And we're going to pause in the middle of the presentation at that point for the board members to ask any questions you may have of Dr. Lindsay. Once you have concluded with your Q&A with Dr. Lindsay, we'll then continue on with the presentation. I'm going to provide a reminder for the community of the approved timeline for the phased return of Option 1 students. I'll be followed by Mr. Freeman, who will be providing updates on transportation, custodial support, and vaccinations. Mr. Freeman will be followed by Dr. Rogers, who will provide updates on our ongoing efforts to support the emotional well-being of our students and staff, as well as to address learning loss of students. And then the final presenter, who will be joining us via Zoom, will be Dr. Robertson, who will be providing an update on the request that we have received from parents to switch between options 1 and 2, or vice versa, as well as an update on our winter and fall athletics. And then we'll go to another round of Q&A with senior staff. This is a graph of the 7-day moving average for percent positivity for the Eastern region over the month of January. These numbers are reported online by the Virginia Department of Health, and you can find a link to that VDH website on our division website. As shown on the graph, the 7-day moving average for the Eastern region was at 18.4% at the start of this month. It then increased to 21.7%. But as of January 6, it has been steadily declining to its current rate at 17.3%. Just last Thursday on the 21st, the Office of the President published a national strategy for the COVID-19 response and pandemic preparedness. The administration is calling this a roadmap of actionable steps planned to address the COVID-19 pandemic, and it includes 12 initial executive actions issued by the President. The President's national strategy is organized around 7 goals. The goals are listed on this slide. I'd just like to draw your attention to the one that's in with the red box around it, the 5th goal, which is to safely reopen schools, businesses, and travel while protecting workers. In support of that 5th goal, the President issued a companion executive order by the title of Supporting the Reopening and Continuing Operation of Schools and Early Childhood Education Providers. The action steps included with the executive order are listed on this slide. In addition, President Biden has called on Congress to provide $130 billion in dedicated funding to support the safe reopening of schools. Those funds are intended to be used to hire more teachers so that we can reduce class sizes to allow for physical distancing, to hire more nurses, to provide for more counselors to address students' social and emotional needs, to implement regular COVID-19 testing, to provide additional PPE, to address any transportation and ventilation needs, and finally, to provide additional learning supports for students, such as those that they might receive in summer school or through tutoring. As I mentioned in my earlier comments, new guidance was just published last week by the Virginia Department of Education and the Virginia Department of Health. This new document, what you're seeing on the screen as a cover for that new document, replaces the VDOE's phase guidance for Virginia schools, which was last updated in the summer, July of 2020. It also replaces the VDH guidance for mitigation measures in K-12 settings, which was last updated in October of 2020. The guiding principles of this new guidance from VDOE and VDH are listed across the top of this slide. They are to support in-person learning with prioritization for young and vulnerable populations, with a continued focus on prevention and mitigation strategies, all while considering the local community's needs and remaining flexible and innovative. The new guidance continues to emphasize the importance of the 5 key mitigation strategies that are listed across the middle of this slide and include the consistent and correct use of face masks by all students teachers, and staff, maintaining physical distance to the greatest extent possible, teaching hand hygiene and respiratory etiquette, cleaning and disinfecting frequently touched surfaces, and finally, the systemic contact tracing of infected students, teachers, and staff in collaboration with local health department officials. And finally, as shown towards the bottom of this slide, the new guidance includes a level of school impact matrix to assess the level of COVID-19 impact on individual schools. You'll notice there are 3 columns for low, medium, and high, with descriptors for the transmission level within a school, student absenteeism, and staffing. The updated guidance from VDOE and VDH includes 5 steps that are intended to guide the decision-making process for reopening schools for in-person instruction. The 5 steps are listed on this slide, and they include, first, a self-assessment of the implementation of the 5 key mitigation strategies. Second, determining the level of community transmission. Third, determining the level of school impact. Fourth, understanding the local community's needs. And finally, deciding which groups or grade levels to include for in-person instruction, along with a timeline for phasing back additional students. With regards to that 5th step, the updated guidance also includes this matrix that combines the level of community transmission with the level of school impact and the school division's ability to implement mitigation strategies. While community transmission should certainly be considered, it is the updated guidance from the VDOE and the VDH that community transmission alone should not solely dictate decisions about in-person learning. Rather, local school officials and health leaders should balance the risks associated with operating during this pandemic with the long-term effects of students not attending school in person. In summary, as highlighted in the 2 corners of this matrix, in the upper left-hand corner, when community transmission is at a low or moderate level, and all 5 mitigations are strong, maximum in-person learning opportunities and extracurricular activities should be offered. Conversely, to the lower right-hand corner of this matrix, when community transmission levels are at their highest or rising, coupled with significant impact on student attendance and staffing, as well as significant impact on the ability to implement mitigation strategies, only then should virtual instruction for all students be considered. So with those introductory remarks, what I would like to do at this time is invite Dr. Lindsay to join us via Zoom. As listed on the screen, there are 5 key mitigation strategies. The last time we were with the board, we spent a considerable amount of time talking about that 5th strategy, contact tracing, and concerns that had been surfaced both by the school division and by the Virginia Beach Department of Public Health in terms of our ability to meet that key strategy. We have some updates for you. So at this time, I would like to invite Dr. Lindsay to join us. And then again, we'll allow time for questions with Dr. Lindsay before she has to sign off and join her next meeting.
Welcome, Dr. Lindsay. This is Carolyn Rye on behalf of the entire board. Thank you for joining us.
Thank you. I've also asked my COO to join us. His name is Paul Brumman. I don't know if you saw that in the chat. Are you also able to allow him to be able to speak?
Can you hear me, Dr. Lindsay?
Yes. Okay, great.
Yes, ma'am. Thank you.
All right, thank you. So my comments will be brief today. I am familiar with the information that was just provided to you that has been being developed over some time and was taken into consideration with information that I've provided to you in the past. I would say that I have worked hard to give you a balanced view, looking at multiple factors for your consideration in making your decision. We're focused today on contact tracing, but I want to be sure to acknowledge that this is a bigger issue than just contact tracing, and also just to point out that when we're at a state of a surge, there is a limit to the value of contact tracing and case investigation to controlling community level transmission. That said, again, want to remind you that we serve in public health in a consultative role. We are not in a decision-making role. I've given you many factors, particularly in my last presentation, for your consideration, giving pros and cons, looking at multiple factors. And at this point, I'd like to offer you an update on where we are in working with the school system on case investigation and contact tracing. However, the final decision is with the school. And today we're offering that information as an update and leaving it to you at that point. Paul, would you like to discuss our plans to date in working with the school to address this issue?
Good afternoon. We've been working with Mary Shaw and our epidemiology staff at the health department to look at what is the best public health practice to support the school. And we were asked to look at our resources. The school has offered if we needed additional resources that we list how they can help. So we have worked through a construct of how we could support the schools immediately and how we can build support around the schools over time. We can provide a epidemiologist dedicated full-time to the school system, and we can provide a couple, 3 or 4, I'm not sure the exact number yet, of contact tracers and investigators that can liaison with Mary Shaw's staff. We feel it's important that there is a public health perspective outside of what might happen in the classroom with the school staff. So these folks would serve in the consultation role as well as helping with the contact tracing and investigations. It's important to understand that within a school structure, contact tracing and investigation is not limited to the walls of the school. It has an impact on the community. So with public health as a partner, we think we can bridge that gap between the schools and the community in a way that it addresses both issues, so that we can, if somebody is exposed in the school and there's people in the community, we can get to that quickly. Otherwise, there's a communication lag in trying to get that information. So having close partners with the school staff and with public health staff and the numbers that we can do immediately, I think will get us to a point where we can provide quality service, particularly according to the rollout plan. The lower schools will be coming back first. We think we have the staff to support that. And over time, we can build around that construct to support as more students come back to school. That's it in a nutshell. I'll be happy to take questions.
You want to go out? Out?
So first, Dr. Lindsay, did you have any more comments at this time? And thank you, sir, for yours.
No, I think that, with the information provided to you before and this update today, I feel that we've given you our best comprehensive and objective overview of the issues for your consideration. And at this point, we are leaving it up to you. This is your decision. We've done our best to give you the factors for consideration, and we will leave it at that.
All right. So we have Mrs. Anderson and Mrs. Holtz. You're in the queue as well. Is that right?
No, I'm not.
Oh, okay. So Mrs. Anderson, go ahead.
So are you stating that contact tracing is not a problem for the elementary students to start back on February 2nd?
I think it is an important factor. We recognize that the risk in younger children is not as great as we progress. And I think as we put this in place, this is a good start to be able to help support that activity in the schools.
I'm not sure that was real definitive. I'd like to have a definitive answer whether or not contact tracing is actually going to be able to be, we can proceed with contact tracing when the elementary students come back. And that includes not just from the students, but contact tracing from staff member to staff member. So that's my point, because one of the things that we put in place was that one of these mitigation factors is contact tracing. And so we put in place that we had to have all 5 of those factors in place.
And it will support students and staff. We're building that support. As I've mentioned, it's not a perfect situation. There's a limit to how effective contact tracing can be when you're in a surge, but I feel that we can support, prioritize contact tracing with the measures that we're putting in place for the younger children.
And does your colleague have anything to add to that, sir, to Mrs. Anderson's question?
No, ma'am.
It was your comment specifically.
I know you mentioned the tracing with regard to the elementary schools. Well, I should ask
I'm not.
Well, let me ask Mrs. Anderson, did you have any follow-up, Ms. Anderson, with either on that question?
No, I wanted to make sure that we can actually do the contact tracing, even though we're in a surge right now.
Again, the benefit of contact tracing in this type of setting is low. We can do what we can in this type of situation.
Mrs. Weems.
Yes, thank you. This is Carolyn Weems. So I guess I'm a little confused, excuse me, because you said the benefit of contact tracing is low in situations like this, yet that was the metrics that kept us out of school January 19th. That's a little confusing. But my question is, with the contact tracing, I'm assuming that you have gotten more contact tracers. I guess the right way to put it is working for the city. Is this correct? Because I know specifically 2 people that I know have applied to be contact tracers and they haven't heard back. So how is this happening? And I guess the bottom line is 2 weeks ago or whenever we met, we didn't have enough contact tracers. And my question is kind of like Ms. Anderson. I'm assuming we do have enough now. That's my first question. Second of all, since you did say the benefit is low, I know my family lives in Tennessee and Hamilton County, and they have actually stopped all contact tracing as of mid-December because they just knew they couldn't keep up. So I'm assuming they feel there in that county that the benefit is low as well. So can you comment on, is there a point where you just stop contact tracing? And again, how did we get more contact tracers than we did a few weeks ago? Thank you.
So first of all, regarding the comment that this was the reason, the school board decided that this was the only reason, I presented you with a balance of multiple issues for your consideration. And this was one of those issues. From an epidemiologic point of view, when you have as much community transmission that we have going on in the community at this point, it's limited how much of that you can follow through on. But we are working on building a system to enhance what we're able to do.
Wait.
I was going to turn it over to Paul to address kind of where we are in terms of resumes or applications that may be coming in that was not coming from us, that may have been to support the school's internal positions. But Paul, can you speak to that a little bit more?
Yes, Dr. Lindsay. To that specifically, in the community newsletter, the school family newsletter, there were job descriptions for contact tracers and case investigators and epidemiologists. We have received a lot of applications for those 3 positions, or we're working through those as quickly as we can. I can tell you the majority of them did not have the knowledge, skills, and abilities. There are a few that we're looking at, but the volume was high, and we're working through those, and we will contact those people that we'd like to have a further discussion. Why we have more contact tracers now, the way that the contact tracers arrive to the local health department is through a centralized process through the Virginia Department of Health. It was a more efficient way to bring hundreds of staff on board very quickly through contractors. We made requests in December for those contact tracers. Over the holidays, the process got slowed down. We will onboard, as I said before, I think it's 3 or 4, 5, I can't remember the exact number of contact tracers this week or next week. So we're able to supplement more contact tracers that way. This is a bit of a nuance, but that's the surveillance system that we use for cases are reported to the local health department. It was a cumbersome process, and we had to dedicate a lot of staff to process right now, nearly 300 cases a day. That system was updated last week, and that system reduces the manpower needed to process those cases. They're automatic now. So we can free up some of the staff that were actually working in the database to dedicate to the school, such as the epidemiologist and some of the contact tracers. So that's why we can shift some of this workload to the schools, because the workload is less on the administration and with that database.
Mrs. Weems, anything else?
No, I certainly appreciate the extra help that y'all are giving the school system with those positions. We certainly appreciate that. And I'm glad to hear that it sounds like we're going to be able to move forward with this. Thank you so much.
Mrs. Holtz and then Ms. Owen.
Thank you, Madam Chairperson. I too have a question about the contract tracing. While we were on our 3:30 break, I went to our Outlook mail messages, and we have a message from a teacher who said a student contracted COVID and was sent home. The entire family now has COVID, and I'm quoting the letter, but nobody has contacted that family. How are we reliant on that? Is this supposed to be self-reporting? So I'm confused about that. I kind of have lost my trust in that contract tracing. In this family, I wanted to be notified, but I know other families who might not be very truthful because of other job experiences. Anyhow, can you address that somewhat?
Well, do you want to take that one, or do you want me to take that one?
I can give it a shot.
Can I,
That
Ms.
is
Holtz?
a good question. If you think about how the disease reports travel through from when someone is tested, if they do get tested, it goes to a laboratory or to a medical provider, then it's reported to the local health department. So let's assume that that's what happened with this family, and you had one person who had a positive test. Once we receive that test, and the lag time, depends, and a surge expands. So it's not the same day. It could be a couple days to a week before the health department receives that report. Once the report is received at the health department, it's assigned to a case investigator, and they do the outreach to the family to do the interview to identify the contacts. And then we have contact tracers who notify those contacts of exposure and refer them to testing if necessary, or isolation or quarantine. Now, not knowing the details with this family, some people who have the symptoms and they call their doctor and they explain to the doctor that someone in the family tested positive and they want to get a test. Sometimes the doctor will say, you don't need a test. You have the symptoms. You're a close contact. Isolate for the appropriate period of time. There is no report that feeds the health department to do contact tracing in that manner. There's also a nuance where if that person has a work site where they got tested, or a doctor that's out of the city, it might take a little bit longer to get to the health department for us to process. But it's not an immediate thing, particularly in a surge, because we're seeing 200 to 300 cases a day, and our staff are working hard 7 days a week, multiple hours a day to try to get to these people as soon as we can. As Dr. Lindsay mentioned, when you get to a surge, that the effectiveness of contact tracing reduces because, for lack of a better word, the cats are out of the bag. So what we try to do is focus on the priorities that have the highest success rate of mitigation. Like in a school, we would want to focus on schools because it's more of a controlled atmosphere. That's where we would want to put our focus. In a community-wide perspective, if we get a lab test, as I explained, and that happens maybe 6 days after the lab test, there's not much of an opportunity to do disease intervention because the person did not know that they were positive and they had opportunities to spread disease. That might be a lower priority than if somebody we got a report within 1 day. Then we have an opportunity to isolate them, educate them, contact the family about quarantining. That's where we have the biggest impact. But in a surge, those delays stretch and our effectiveness with contact tracing is reduced. So I'm sorry I can't answer the direct question about that family, but that's kind of how it works.
Well, thank you. So what you're telling me is because of the numbers, there will be a delay. But if somebody, either through a doctor's office or through a professional, has been told that they are definitely positive, they will be contacted in the future, right?
Yes, ma'am. We
Thank
take
you.
every
Thank
effort to do that.
Can I just piggyback on that by asking, sir, who makes that decision to prioritize the schools? Because that does make it a different issue. If the capacity is not up to ideal, and yet the school division would know that we would still be a priority, that could make that's an important distinction.
That's why we are dedicating more resources to the schools, because we want to have that timely response. We want to be able to bring to the school and Mary Shaw's team the things that we're seeing in the community as well as going to the schools. There's a lot of things that go on. You might have family members in multiple schools, and the way we want to make sure we understand the transmission that's occurring. If there's connections right now, I think that sometimes it's hard to make those connections in multiple schools. If there's activities that we know about, like a private sports team, and there's an outbreak, it would be nice that we have an epidemiologist who can coordinate that information and work with Mary Shaw's team to say that there were students exposed, and we want to make sure that they're not coming to school if they should be quarantined. So that's what we want to continue to do. We do that now, but we want to increase our capacity, particularly during a surge where the cases are so high. We want to supplement what we have now and focus on the students and work closely with Mary's team. We can't do it just with public health. We're going to need Mary Shaw and her team as well.
Dan, Miss Owens, and then Mrs. Franklin.
Thank you. I have two questions. I guess the first one, just starting off with thanking Dr. Lindsay for the comprehensive and objective factual report that you provided for us at the beginning of the month. Out of the 3 pages, the first bullet talked about the safest option being waiting while in a surge until the surge has stabilized or is at a minimum showing a substantial downward trend. Would you say that we are currently have shown a substantial downward trend?
I think it may be early to say that. I mean, we're definitely in a surge. It is significantly higher than the surge we experienced in the summer. So it may be coming downward, but we are still substantially seeing a substantially greater burden and trend of disease than we've seen throughout this pandemic so far.
Gotcha. And my other question is about the contact tracing bit. I am encouraged to hear that more resources are being put together and something is being built. But where would you say we are right now and the time frame to actually having that network built versus we're building it?
Well, we're starting. However, we have identified and put in place some key support staff for this by having public health people who have the knowledge and experience who can kind of help support and oversee the team. So I think that's an important factor. The other thing that we took into consideration is this is starting with preschoolers and elementary school children. And so the higher risk groups, middle and high school, are coming later. So it will give us some time to build, but frankly, building is going to take some time.
Sure. And just for clarification, is the health department is aware that we're bringing middle school 6th graders and 9th graders of high schoolers back all within this first group? And is that part of the consideration? I know you mentioned starting with preschoolers and elementary schools, but
Hold on,
making sure that you
Ms.
guys are
Owens.
aware.
Yeah, hold on, Ms. Owens. Dr. Spence would like to clarify that for all of us.
Yeah, not ninth graders. Sixth graders only, not ninth graders. Just want to be clear about that.
Right.
Not understanding the comments that are going on behind the scenes here. From early on with the plan that we saw, it appeared that it would be small numbers in a building. So one grade school, maybe about 150 children from what we saw. So relatively low number. I don't know if that's changed. I'm seeing nods, yes, no. I'm not clear on that. Where you are.
Maybe I can add some clarification.
The plan has not changed. It was pre-K through 6, so only 6th graders in the middle schools. The numbers you're citing are accurate, Dr. Lindsay. And I know when we talked about that, and as you stated in the statement to the board last time, that those numbers, I think your specific comment was that those numbers were relatively low and that would be acceptable in terms of our plan for moving that forward.
Ms. Owens, any follow-up to either of those comments?
No, that's it.
Mrs. Franklin.
Thank you, Chairman Rye. I just wanted to clarify from Mr. Drummond. So just because we are going to have many emails and much communication about the timeline after tonight's meeting. So I think just to put it in perspective and be clear with everybody that right now you do feel like with the assigned epidemiologist and additional resources that you would apply to the school and Mary Shaw's team, that you feel like we could properly contact trace for the K through 6 group that we plan on potentially bringing back. And then Dr. Spence, I believe you would do we still have that as part of the plan to ensure that we could properly close schools as we get those numbers in and make sure that we're following the numbers and statistics within the school system at that point. So that's my first question for Mr. Drummond, is to just clarify that do you feel like with the resources that you're going to provide to the school system that for the K through 6th group that we can properly do our jobs for contact tracing?
Yes, ma'am. With the public health resources that we were able to take to the schools and with Mary's team, yes, I think I know we can be ready.
Okay, thank you. And then secondly, my next question is in regards to the vaccines. We've had a couple of emails from the teachers stating that although, we've rolled out the 1B group and we've allowed them to start getting their vaccines, they're finding it very difficult to actually get the appointment and obtain the vaccine. Can you give any kind of clarification or any assistance on how we can get them to properly make an appointment, or any things that you see just from, the rollout of the 1B group, any suggestions to make that easier for them so that they can obtain their vaccines?
So we have, sounds like I hear someone else about to speak.
Yeah, and thanks, Dr. Lindsay. So there is a slide. This is Jack Freeman, the Chief Operations Officer, where we're going to talk about the status of the vaccine. And happy to address that question as part of the vaccine discussion that I'll be presenting later.
Sorry, I didn't mean to get ahead of you. So, thank you. But if these two guests have anything to add now, since you won't be with us.
Shortly, feel free to weigh in. Are either of you, well, we know about Dr. Lindsay, but sir, do you have any direct role with the actual vaccine distribution process?
Lead on the vaccine distribution in public health. Right now, our key limitation is that it is a lot of people, and we have a very limited amount of vaccine to cover. But we have started with a 1B group. We have started vaccinating those in school, and they are in that top tier of those that we're working on now in the 1B group. But it is a challenge.
Okay, anybody else?
Madam
Mrs.
Chair,
Melnick.
I'm just checking with my Zoom participants. Hands raised are still Mrs. Anderson, Mrs. Weems, Mrs. Holtz. I wanted to make sure you didn't want to get back in the queue. Okay, then Mrs. Riggs.
All right, Mrs. Riggs.
Okay, so is it true that absent testing, there's a true way to know there isn't an outbreak? I mean, in a school, because people can be asymptomatic carriers, so any symptomatic cases may seem like isolated cases, not part of a school spread, like systematic cases.
Really having difficulty hearing the question. I'm sorry, it's a little garbled.
Okay, so if there's absent testing in the schools, there's, no true way to know there isn't an outbreak in a school, because people can be asymptomatic carriers. So any symptomatic cases may seem like isolated cases, not part of a school spread, like systematic cases.
Sure, that is possible that there may be asymptomatic cases or individuals with mild symptoms that are not recognized as having infection. That is one reason why, we are following this very closely and want to work very closely with the school to help us follow the data and look for trends and any epidemiologic linkage that would suggest transmission. But yes, it is certainly possible that we do not identify all cases without the testing. And, even testing is not 100% accurate. It depends on the timing. We, in a number of instances, we've encountered people who may have been a contact to a case, and they think that they can rush right out and get a test, and as the test is negative, that they are unlikely to be a risk, whereas they could be incubating disease and it just not be apparent yet.
I just want to follow up with just one comment. You just seem to be guarded and not sure. So I'm concerned with what message we're getting about sending our kids back to school.
There's no 100% guarantees here. What I've tried to give you is a balanced view of multiple factors to consider. And Those factors have not significantly changed. And I know that it's a very difficult decision, but it's not our decision to make.
Mrs. Anderson?
You're trying to give us information and letting us make the decision, but I just want to make sure that you're aware that preschool to sixth grade, it's not small numbers. We're talking approximately 30,000 students across the city. And a lot of adults who are going to be exposed to this as well. So I realize that the number of younger students is not as prevalent, but you know, we're finding that children are getting COVID now. That's contrary to what we had heard in the past. And so now we're finding that children are getting it, and especially age 10 and up. And they're having lasting effects. So I'm really, really concerned, and I don't want us to proceed on this if it means we're just, you know, rolling the dice and we're putting people at risk. I'm really, really worried about it. And I realize that you have a hard job of trying to walk a fine line and just giving us information and not trying to sway our decision. But at the same time, I want you to be aware that, you know, some schools have 450 students, some schools only have 150, but most of our schools, our elementary schools anyway, are averaging anywhere from 300 to 450 students, preschool and special ed, by the way, as well. So preschool to sixth grade. So I just wanted you to be aware of that.
Well, thank you for those comments. You know, from an epidemiologic point of view, we're aware that concentrations of people, risk does go up. You know, I think an important factor is how well one can follow the mitigation factors, but you know, that's not to say that there isn't increased risk when you have more and more people and crowding. But again, done my best to try to give you those factors to consider.
Thank you. Dr. Spence, can you, because
Reminded we have, these are option one students heading back. Does the staff have a ballpark figure of, and I understand this breaks down into 55 separate elementary schools, which I try to keep reminding myself, but given that we do want to look at the totality of the community impact, is there a ballpark figure of K to 6 or pre-K to 6 with option one students?
I can get you a precise figure. I don't have it in front of me. I think the question that was asked earlier that Dr. Lindsay was talking about 150 to 200 students was specific to sixth grade students in a building and specific to ninth grade students in a building. So one class in a building, because she was talking about the older students. And so there wasn't some, I don't think, an intention to state that there were 150 students in any given building. That varies across buildings. Some buildings have had more students choose option one than other buildings. And so we have those exact numbers. I don't have them in front of me in this moment, but certainly we've shared them before, and Dr. Robertson probably can have them before he comes up tonight to talk about that data. I want to emphasize the germane fact, a couple of germane facts. One is, when you have children in a building, whatever the number is, are you able to put in place the appropriate mitigations? And if you are, the evidence demonstrates that you're able to limit the risk of transmission, not the risk of cases, because that's what Dr. Lindsay has told us, and that's what we see, that you'll have cases in your buildings, and as you have more cases in the community, you'll have more cases in your buildings. And so the question is, can you minimize the risk of transmission? Because people are going to bring those in. And I guess what I'm a little confused about relative to the lines of questioning is I thought the board took a vote last week to move forward with opening of schools if we met two kind of limiting factors. So the one was that we saw a decrease in percent positivity, and we certainly have seen that for now 2 weeks straight. If we were able to assure that contact tracing could be in place, I heard Mr. Brumman state very clearly, yes, that would be in place. So I'm just trying to also understand how we can help provide further information about the line of questioning.
Okay. And my point was just to remind the public that on average, 40% of our students are fully virtual, understanding that does vary by elementary school. But thank you for that. Mrs. Weems.
Yes, I was going to kind of say exactly what our superintendent just stated. I'm confused too over these questions, because last week, after 10 or 12 hours, and after multiple substitute amendment motions, whatever, and then after another meeting to clarify, we voted to move forward if we could get the contact tracing at a certain level. We have declined for 2 weeks now, so that has been met. All our other mitigation strategies can be met because we've seen in the past that they have been met. And now the contact tracing is going to be met. We do not have 500 or 600 students per school at the elementary level in this scenario, because they are all not option 1 students. So I heard clearly that we are getting extra help with the contact tracing. I've heard clearly that Ms. Shaw is on top of it. And so in my opinion, that these have all been met, and I'm not sure why we're backpedaling now, because we have seen a decline now, and that was the big one that many of you added to the substitute motion. We have seen a decline now for almost 2 straight weeks. And so I'm glad that the city has worked with Mary Shaw and have come up with a plan to make sure that we have contact tracers and to make sure that we continue to build this. So after we get our students in next week, our younger students, that we will be able to move forward and get the older students back in school. Everyone from the president to our governor, to our own physicians, to the physicians that email us in know how important it is to get these students back to face-to-face learning. That's what we've been going for weeks and weeks now. We've met the criteria, so I'm anxious to see how we're going to make this work and how we're going to be able to stabilize it till the end of the year and how we're going to bring all our students back. Thank you.
We have 2 more staff presentations, and this is just a final opportunity for members to ask any question related to either of these points of our 2 guests. So Mrs. Melnick.
I just wanted to say that we are not by trade risk managers. We are not doctors. And so I don't think the last point was fair. I think what is fair is that we are in a surge and that our teachers are afraid. We have 15,000 employees that are afraid, and we understand that. We're afraid. We sit here masked. We sit here social distance. And I think honestly, if I'm being honest, I just want someone to make the decision for me, because I'm not equipped to make this decision on this level, which is why I think there have been so many questions basically asking Dr. Lindsay, and her response is, I can't do that. I'm giving you what I know. And so what I will take, I'm scared to death, but I will say that Dr. Lindsay said that she is okay with our phased in approach. And we have Dr. Spence's assurance that he's going to shut it down school by school if he sees these cases. And it has been presented to us that our contact tracing will be moving forward. And that's the best we can do at this point to bring a happy balance to this community, because we certainly do hear both sides loud and clear all day long. But I really do think this is very difficult for this board. Very, very difficult for our staff, and that we're doing the best we can.
Thank you, Mrs. Melnick. So any other questions to our two guests before we have, because we still have, bear with me a moment, Dr. Robertson and Mr. Freeman so go ahead, Mrs. Franklin.
I just wanted to quickly thank Dr. Lindsay and also Mr. Drummond, and I can sincerely say that we appreciate all of the support, information, and now resources that you're providing to the school system. So I just want to personally say thank you for all that you are doing and helping to support our BBCBS. So thank you.
Okay.
Thank you. I did want to comment again that I provided you with a balance of information, and it is an issue of balance, and the final decision is yours on where you want to go with this. We are in a surge. Our numbers may be coming down, but it is a surge. And there are multiple factors. It doesn't just boil down to case investigation and contact tracing.
All right, thank you both. You're welcome to stay on and view or get on to your other commitments. But meantime, we'll bring Dr. Burke
Back to, so that we can continue this conversation internally.
I need, thank you. I need to know who's still in the queue. I had some hands raised, one is down, I have Mrs. Owens. If you are still in the queue, just leave your hand raised and I'll put you in. Does she get to go?
Miss Owens, are you, because I'm not sure if our two guests have left.
No, they're still here. I can see them.
Okay.
I was hoping that since we had them here, if you're able to provide any information on what we should be expecting as a system, as a community, with the new variants that we are seeing, I guess has now been identified in Northern Virginia, and what additional considerations, if any, that should bring to us.
Okay, so I'll start, and if Paul wants to add comments to that. This is concerning. We're hearing about variants that have, it appears to be significantly increased ability to move from one person to another. And it appears more and more that cases may be more severe among some individuals. So far from what I have heard, our vaccine appears to be beneficial for these variants. And we're seeing yet not significant numbers of cases in the US that may change over time. It is an ongoing concern that public health will continue to monitor. At our state lab, there is the effort to continue to monitor for these strains and keep an eye on their presence in the country and in Virginia. Paul, is there anything you'd like to add on that?
The only thing, Dr. Lindsay, is the mitigation strategies are the same, even with this variant.
Right.
It can cause more problems, but the mitigation strategies don't change.
We do have a problem in our community with people hanging in there and being compliant with those mitigation strategies in our community, and would encourage the board and school system at every chance that you have to educate and remind parents of how important this is, as well as students in controlling transmission.
Okay, are we good, Ms. Owens?
Yes, thank you.
All right, Dr. Bergen.
Thank you, board members, for those questions. I just want to go back and do a little bit of a reset. I'm redisplaying for you from prior to when we had our local health officials join us, the guiding principles from the Virginia Department of Education and the Virginia Department of Health. These were just published last week. We're gratified as administration to know that the recommendation we brought forward to you before these guidelines were even published, that our recommendation is in complete alignment with this guidance. I'll repeat those guiding principles across the top. They are to prioritize young and vulnerable populations with a continued focus on prevention and mitigation strategies, while considering the community's needs and remaining flexible and innovative. But the key being with the emphasis on in-person learning. We've said that the adjustment we've made is not if we should have schools open, but how to open them safely. And that's the key with the mitigation strategies. We mitigate well in the public school systems. Masks, physical distancing, hand washing, cleaning, disinfecting, and contact tracing are not options in our schools. We are vigilant about those mitigation strategies, and we have introduced, as I'm not going to steal Mr. Freeman's thunder, but we will have teams of administrators in all of our schools ensuring that we are meeting all of our mitigation strategies. If we could then forward 2 slides, Regina. 1, 2. Yeah, to this slide. When, even when we're in higher or highest, you will see that the guidance from the VDOH is that we consider the impact on individual schools. We look at student absenteeism, our ability to staff, our ability to meet the mitigation strategies, but even at highest, we should be prioritizing our youngest learners and our most vulnerable populations. So if we can then go ahead, Regina, and advance to the timeline slide. This is the recommendation that we brought to you several weeks ago, that we've had extensive conversation about, and that we continue to recommend. And unless and until the board takes other action, it's our intent to move forward with this phased return of students beginning next week. Monday, of course, is an asynchronous day for students and teachers. So on Tuesday, February 2nd, elementary students, grades PK through 5, and grade 6 students whose parents have selected option 1 and wish for their child to receive in-person instruction will be welcomed back into our schools on Tuesday. We will then have 3 weeks, 3 continuous weeks to monitor the effect of bringing those children back onto our ability to contact trace. 3 weeks to assess that we are meeting those all 5 key mitigation strategies before we proceed with the phasing back of middle school and high school out until the 23rd of February. Okay, so that's my part of the presentation. If you can advance for me, Regina. Next, I would like to invite Mr. Freeman to share an update with the board about transportation, custodial readiness, food services, COVID safety teams, and vaccinations. And I believe Mr. Freeman's participating via Zoom.
Thank you, Dr. Bergen. I am.
Yes, sir.
Hello and welcome, Carolyn Rye.
Thank you, Madam Chairwoman, members of the board. Just wanted to, as Dr. Spence said, give you an update on our readiness to be able to transition back to face-to-face instruction in accordance with the plan that he just presented. From a transportation standpoint, we are ready to go. We have the drivers, we have the buses, we have the cleaning materials. We are set to be able to transport kids on the 2nd of February. The same is true for our custodial readiness. We have the custodians available to support that plan, and we have the supplies. Additionally, and as you know, bus drivers and custodians have been an area of focus to ensure that we're able to meet mitigation and meet our mission. And to further support our custodial preparations, later on this week, there will be a principal packet memo that's going to go out. That pretty exciting opportunity that HR worked very hard with us to be able to create, where we will be able to take classified staff who are not custodians, and they will be able to function as custodians and get paid at their current rate, and to be able to receive overtime for that. So essentially what that does is it increases our capacity to be able to provide custodial support. And it's just another opportunity that we've been put in place to ensure that we can continue to meet those moving forward. Additionally, our food service team is ready to transition to support face-to-face instruction on the 2nd of February. We are ready to go with that. Just as a reminder, because transportation will be used to transport students again, those distribution sites that we had in the neighborhood will no longer function as of this Friday because those buses will be used to transport students to and from school. And then finally for this slide, as Dr. Bergen mentioned, the COVID safety assessment teams. I mentioned those to you several board meetings ago. We have 7 teams that are ready to go as of the 2nd of February to go in and evaluate how our mitigations are being implemented. Again, this is intended to be a supportive process. This is ultimately going to be a bi-weekly process. So every 2 weeks, a school will get looked at. However, for that first week, every one of our elementary schools is intended to receive an assessment that first week to get us off on strong footing as we bring our kids back into the classroom. Next slide. The last, and I noticed the question that came out a little bit earlier about vaccinations and wanted to provide you an update of our status. So as of last Thursday, all who requested to receive their the vaccine, which was over 7,000 names, have been submitted to the Vaccine Administration Management System. As a reminder, the last time that we were here that we talked to you about this, and Bob Engel came over from the Department of Public Health, and he talked about the limited amount of vaccine and trying to prioritize correctly. At this point in time, we would have expected to have 1,500 people scheduled to receive the vaccination in the VAM system. And we have over 7,000 in at this point. So what that means is Bob Engel and his team have been doing a tremendous job of, with great detail, managing the system and getting our staffs in there in a good priority. And the dates that you have listed on there, the first date that we were originally intended to receive vaccination would have been yesterday. However, he was able to find opportunity and get us moved up in that timeline. So we actually had employees who received their vaccination on the 21st. Again, so very good progress as it relates to the vaccine. We are awaiting the next open opportunity, and you have likely heard that we have people that are in the VAM system, but there isn't a scheduled appointment, and that's based on vaccine availability. It's also based on another factor. So since I created this slide later on today, I got an updated communication from Bob Engel. We're expecting to see more availability open for this Saturday. There's going to be a communication that's going to go out tonight that's going to include that information. And we're going to encourage our staff throughout the day tomorrow to continue to check the VAM system for availability, particularly for the convention center location at zip code 23451, because we expect that there's going to be more opportunities that are going to be captured there. When Bob Engel came to talk about 2 weeks ago, he mentioned potentially transitioning away from the VAM system. And we do expect that transition to occur in the future. So I want to say right now, anybody who's already in the VAM system and was able to schedule an appointment and already get their vaccine, they're good to go. Everything's going to be fine with the VAMs. But as we move forward, somebody who hasn't gotten in the system yet or has not been scheduled to receive their vaccine within the next several days or so, we're going to look at transitioning to the other system. Here's an important point to know about the VAM system and why we're going to transition away. Once you get into the VAM system, that opens up the opportunity to look not just in the city where you're employed, you can look to other cities to be able to find opportunity. So as you can imagine, Bob Engel has been doing very detailed work ensuring that he is managing the phase 1B population in Virginia Beach. However, others can come into that system and schedule it in Virginia Beach. The same thing has occurred for some of our employees. They have gone over to Norfolk and gotten their vaccine over in Norfolk, and that creates challenges. So the system that we're going to transition to will help improve that process and ensure that we are able to take care of the Virginia Beach employees that we're trying to take care of. All right, and the last thing that I want to mention So you can see that we have over 7,000 that are in the VAM system or kind of in the process who've elected to receive the vaccine up at this point. What that means is when you have 15,000 employees, that roughly half of our employees at this point have indicated their preference to receive the vaccine. So we're greatly focused on communication and education so that we can make that population who hasn't indicated their preference to receive the vaccine as comfortable as they can, as educated as they can be, so that they can make the best choice for their personal situation. The Department of Communications and Community Engagement is developing several different products and things to be able to help with that communication. So with that, I will turn this over to Dr. Kip Rogers to go through the next part, and then I'll take questions at the end. So Dr. Rogers, over to you.
Thank you, Mr. Freeman. I just want to do a time check because I know Dr. Robertson is going to come behind us. You want me? I'm sorry. I just want to do a time check.
I mean, we'll just see how far we get because we have the option of continuing the workshop
Okay.
later on in the formal meeting.
Perfect. Just stop me if you need to. Good afternoon, Chairwoman Rye, Vice Chair Melnick, school board members, and Dr. Spence. This afternoon, I will provide you with a high-level update on where we are with planning, teaching, and assessing in the Department of Teaching and Learning in the midst of our pandemic. And as we approach the second semester of our school year and reflect on these past 10 months, it will come to no surprise that we continue to be concerned as well as focused on the emotional well-being of our students, staff, as well as the learning loss and the impact that the learning loss could have on our students. And through the next several slides, I will provide you with an update on our progress in dealing with these two issues. And first, I will talk a little bit about social emotional learning. And as we've shared many times over these past 10 months, we continue to be focused on addressing the social and emotional well-being of our students, staff, and offering support for our families. And at the elementary level, our school counselors continue to provide SEL instruction in addition to teachers providing SEL strategies that are embedded in our curriculum. At the secondary level, we continue to provide students with SEL support during the advisory blocks, and our staff are trained monthly on the best practices to support that work. And as has been shared in your earlier meetings, we continue to provide staff with a variety of district and site-based professional learning opportunities that actually began this summer. And our Mondays are still used to support those trainings. And additionally, you may remember to guide that work, we have what's called SEL, or our Social Emotional Learning Implementation Team. And that team meets about every 3 weeks to ensure that the work of SEL is aligned and that supports and resources are provided for our schools. So I want to provide just a little bit of detail on the SEL resources that we are providing. We're excited that the VBCPS website development team is collaborating across departments to develop a school division SEL website that will be an excellent addition to our SEL strategy stockpile that our staff has access to via our intranet. And through the work of the SEL, we found it important to utilize data to identify resources and supports that are needed for our students. So as a result, this fall we did administer an SEL survey to all of our schools, and 8 schools were identified to receive student identifiable data, and a 2-part professional development series was developed in order to support those schools to identify resources and strategies for students and teachers. On February 22nd, we will hold a trauma-informed practices symposium to support SEL strategies and resources. And right now we have about 620 staff registered through all of our schools, representing 78 teams who will participate in about 34 choice sessions. So we're excited about that. Also, our upcoming February citywide principals and assistant principals meeting will address SEL. And then lastly, relative to SEL, is our mental health task force. We've created the task force where we've invited about 40 participants that represent internal and external stakeholders, to include those groups that you see on the screen. And Dr. Spence will be providing the planning team with information relative to school board participation. And the purpose of the mental health task force is to identify factors that contribute to the mental health needs of our students and staff, as well as to communicate what services are available currently for students and staff, to improve the coordination of those services, to review proactive measures and best practices for improving staff and student mental health, and then finally making recommendations for improved service delivery for our students, staff, and families. And the first meeting is scheduled for February 22nd, and we will plan to provide you with a report that also includes recommendations during your July 2021 retreat. Now I'll talk a little bit about where we are with instructional technology. First, I would like to point out that 18% of our teachers of the year throughout the entire school district are from the instructional technology team. We have 11 instructional technology specialists and 4 library media specialists who've been identified. And this certainly speaks to the excellent work that they've been doing to support our students and staff. So I want to give them a big shout out. We do continue to provide opportunities for teachers to receive training and leveraging technology to enhance teaching, as well as being able to teach concurrently. So for example, yesterday, Indian Lakes Elementary School provided training on several interactive resources to include Storia, Whiteboard Chat, and Nearpod. Our instructional technology coordinators are supporting the efforts of PGI with their ongoing series called Survive and Thrive for new teachers that shares training on concurrent learning models and as well as video tutorials on tools for engagement. Our team also does support the efforts of the Department of Technology in the distribution of laptops to instructional staff. And currently we have 12 schools that are still waiting distribution, and we anticipate that they should have those at the beginning of term 2. Wireless headsets were delivered to all schools during the first week of January, and some of our secondary math and science coordinators are organizing numbers for math tablets to some of our math and science teachers, and the distribution of those resources should be given by the beginning of February. Now, just a little bit about our students with disabilities. Our Office of Programs for Exceptional Students, staff, continue to support schools with professional learning, as well as individual support for teachers to address the academic, social, emotional, and behavioral needs of those students with disabilities during face-to-face, as well as virtual instruction. And we've been fortunate to be able to leverage the CARES Act funds to purchase materials and resources for our students who require the most intensive support and those who will continue to learn through option 2 or virtually. We've also been able to provide additional instructional materials for our teachers as well as PPE, and they should be receiving instructional resources, within the next couple of weeks. So now I want to spend a little bit more time on how we're addressing our youngest learners. Regarding our work with mitigating the learning loss that we're concerned about at the elementary level, as you may recall from your January 5th meeting, our team does constantly review data to inform the instructional decision-making, curriculum resources, making funding decisions, as well as outlining the supports that our schools need to meet the needs of our students as well as our staff. And what you see in front of you represents just some of the work that's being done to address the needs of our students to effectively support them. And as I've shared before many times, significant modifications and enhancements have been made or were made this past summer to the curriculum, as well as ongoing additions and resources are added. We've reduced the amount of assessments, extended testing windows, and provided flexibility to schools to ensure that we are not only meeting the requirements of the Virginia Department of Education, but also providing strategic planning support to our schools. So for example, if a school is requested to move a math objective back a week so that they have additional time to teach as well as to assess it, our math team has done a tremendous job in supporting the strategic planning on how to integrate that objective into future units of study. And of course, we do have a strong focus on equity as students in need of additional intervention beyond what's taking place in core instruction and differentiated small group instruction, they receive those interventions from our PAL support staff. And as a reminder, in the January 5th meeting, I did share that we were able to hire 21 additional PALS support teachers using EIRI grant funds. We're also fortunate that we have, at the elementary level, various numbers of specialists to include gifted specialists, reading specialists, instructional technology, as well as math specialists to support our staff in leading data meetings and modeling effective instruction. To further mitigate learning loss, we are currently planning for summer recovery experiences and developing learning experiences to support all of our pre-K through 5 students, in addition to developing targeted remediation opportunities to those students most in need of support experiences over the summer. And all the work that we're doing certainly is not as effective without providing a high-quality professional learning program for our staff. So what you see on this slide is just a mere snapshot of some of the professional learning that we've been providing for our teachers and staff using feedback as well as data. So for example, option 2 teachers were surveyed earlier this year, and they were asked what type of professional learning sessions would support them in being able to deliver instruction. So our team developed a new session each week that was specifically aligned to what they requested, and they made those sessions available to all teachers, and those who weren't able to participate in person, they were able to access that information virtually via video. Our principals also receive monthly instructional leadership professional learning sessions as well. And for example, last week, elementary principals received professional learning from our department on ways in which they can support PLCs or professional learning communities, as well as coaching. And the great thing about those sessions is that our team also models strategies that teachers should be using when they're teaching virtually. And speaking of coaching, coaching is one of the most powerful professional learning approaches that we use in our school district. One-on-one coaching cycles with teachers happen when coaches are able to co-plan, co-teach, and co-assess learners. Our team and our school coaches do this work daily, and they also facilitate planning sessions with those teams weekly to support learning. And then finally, relative to elementary, we were proud that so many of our elementary leaders, including myself, have been or are being trained in the science of reading. Many are completing the year-long letters course, which will make a significant impact in meeting the needs of our readers and making sure that they're being successful. Relative to secondary response, in that this year, our secondary schools are implementing a different schedule. We've been focused on curriculum and instructional planning, teaching, assessing, and responding to students when they're not being successful, and doing so around the lessons that we learned from the first term. So some of the professional learning sessions that were offered to teachers on Mondays to support this change and to prepare them for the second term: student engagement, small group instruction, and creating assessment for content skills and depth of knowledge. Some examples of professional learning opportunities for administrators have been focusing on providing meaningful feedback to teachers to increase student engagement and achievement, and student progress monitoring through data trackers. And as with elementary, our secondary instructional team does continue to leverage ongoing PLC support that's given from our coordinators as well as our specialists to assist with building-led professional learning. And lastly, as you may know, our schools are winding up with SOLs and mandatory post-assessments for the first term. We do plan to review data on these SOLs and post-assessments and the locally developed writing assessment in early next month. The data that we collect will help to identify gaps to be able to use to respond to our students. So for example, our math team has noticed some gaps as we move through the first term, and they're making necessary adjustments for the second term. As a result, we're not only waiting for this information now, we're certainly not waiting until summer to address student needs. We've designed a 4.5-week course for our middle school students in math and language arts to be able to capture some of those skills that they missed so that they are successful for the remainder of the year. And with that, I will turn this discussion over to Dr. Robertson to discuss additional information on our student progress. Thank you.
Dr. Robertson, may I interrupt a moment? Carolyn Rye, can you share how much time you need so we know whether to proceed now or defer? As it is, our Q&A is deferred.
I would say 5 minutes.
Okay, go for it.
Thank you, Dr. Rogers. As we conclude the first semester in elementary school and term 1 in middle school and high school, schools do have several key tasks to complete this week. 3 of note are included here on this slide. At the secondary level, schools are reviewing failures, particularly in math and English, to determine how to best serve those students in term 2. And Dr. Rogers just shared with you one of the ways we're addressing that with middle school students. At high school, additional scheduling flexibility allows these students to retake the failed course immediately without placing them farther behind. As noted in the last board presentation, all staff have been notified of their second semester term 2 schedules, and all students and families will be notified by tomorrow. Finally, schools are reporting any staff to DOSL that will earn a stipend for concurrent instruction, with payments expected as part of the February 15th paycheck. On Tuesday next week, the second semester term 2 will begin, and school staff are preparing to welcome the pre-K students that selected in-person learning to the classroom 4 days per week. Assuming things go as planned, schools will be prepared to welcome back in-person students in grades 7 through 12 on the hybrid schedule that's 2 days in, 2 days virtual, beginning on February the 23rd. As expected, we did have both families and staff expressing interest in a change. If you could switch the slide. We did have families and staff expressing interest in a change in options, in person and virtual, for the second half of the year. Elementary school reported 222 requests for a change from in-person to virtual, with 212 being accommodated. Middle school reported 367 requests for this change, and all requests were met. High school reported 535 requests for this change, again, with all being met. So in summary, 1,124 requests for a change from in-person to virtual were made, and 1,114 requests were met. In terms of staff requesting a similar change, elementary schools reported 9 requests with 1 being met. Middle school reported 19 requests with 7 being met, and high school reported 23 requests with 11 being met. So in summary, 51 staff requested a change in teaching placement from in-person to virtual, and 19 requests were met. Schools also noted both families and staff requesting a change from virtual to in-person for the second semester or term 2. Elementary school reported 670 such requests, with 487 being met. Middle school reported 467 requests, with 330 being met. High school reported 438 requests, with 401 being met. So in summary, 1,575 requests for a move from virtual to in-person learning were made, and of those, 1,218 were met. Recall, it's more difficult for schools to honor in-person requests due to physical distancing restrictions in all classrooms. We also had staff request a change in placement from virtual to in-person. Elementary school reported 4 teachers making this request, and none could be accommodated based on student needs. 1 middle school teacher requested a change, and it was granted, and 10 high school teachers requested a change, and all were granted. So in summary, 15 teachers requested a change from virtual to in-person, and 11 were granted. For term 2, the Virtual Learning Center will be adding the following middle school courses to their course listing: Earth Science, Algebra Honors, History 7 and History 8, and English 7. We will not be needing any high school courses or middle or elementary school courses at the VLC at this time. Next slide. Last week, we shared our decision. Next slide, please. Last week, we shared our decision to cancel. Next slide, please. There we go. Last week, we shared our decision to cancel middle school winter season 2, which was slated to begin next week. As you also know, we are competing in winter varsity sports in 99 programs across all 11 high schools. Last week, I deployed my entire team to observe our safety mitigations for our first week of competitions. And we are happy to report that all of the safety mitigations were being followed as designed. In addition, school administration and the athletic trainers are utilizing all prescribed safety protocols each day for practices. To date, we have had one team out of 99 teams choosing to end their season due to COVID concerns. We have also had 8 of the remaining 98 teams required to quarantine for 14 days due to a positive case in a player or coach. 4 of these 8 teams' quarantine periods have ended, and they are returning to competition for the last 2 weeks of the regular season. In addition, we have had individual athletes or coaches on 14 of the 99 teams across 5 of the 11 high schools facing quarantine that did not require a team quarantine. With Gloucester as the only local division participating in winter sports, we can expect a number of our teams and athletes to qualify for postseason competition, which begins in mid-February. As we prepare for fall sports, high school teams are participating in structured preseason conditioning programs. My team is monitoring health and safety mitigations, reviewing fall schedules, and keeping in close contact with the Virginia High School League and other local school divisions. To provide our varsity athletes the best chance to play, we will be canceling JV fall sports, reducing competition dates, lowering team sizes, and playing only a Beach District schedule. Our next steps include monitoring school programs implementation and our ability to continue working closely with health services and keeping the school board informed of our progress. And that concludes this part of the presentation.
So as previously indicated, this workshop we will suspend our question and answer session until formal agenda item 17 workshop is needed. So we'll have some time to digest the information from our 3 staff presenters, and we will reconvene back here at 6 o'clock. Workshop adjourned.